In continuation of the fight against coronavirus in Nigeria, the Ogun State government is not leaving any stone unturned in ensuring that residents of the state are adequately protected. The state government has identified about 100 persons who came in contact with the index case of the disease in the country. It would be recalled that the index case in Nigeria, a 44-year-old Italian male, had traveled to the southwest state for business when he developed symptoms.
Joining us now is Remmy Hazzan, the spokesperson of Prince Dapo, the Ogun State governor. He'll also be giving us updates on developments in the state amid the outbreak of coronavirus on the global economy. It's a pleasure talking to you today. I'm really excited because, it looks as though Ogun State led the way as regards the contact tracing exercise. Once they discovered this, they sent it back to Lagos. Would you say that there's already a mechanism in place to be able to do this, even for the most remote areas in Ogun State?
Well, first thing I want to say is thank you for having me. My designation is Special Advisor to the Governor on Communications, so that you correct that going forward. However, the issue of the referral to Lagos is the healthcare architecture of the country. Infectious diseases of that magnitude can only be attended to at 3 locations in the country because of the specialty involved in carrying out this diagnosis: Lagos, Irua in Edo State, and Abuja. So the closest to us in the circumstance is Lagos. So when the suspicion of the symptoms were noticed, it is just sensible that we do the needful. And that's why the index case was sent to Lagos.
Now, talking about contact tracing, and thank you for clarifying that, because a lot of people were wondering, why did Ogun have to send the index case to Lagos? And there were even rumors that he was rejected in Ogun State, and that's why he came to Lagos. But we've heard that clarification again, and it's good to hear from you again. But let's talk about contact tracing. How much have you been able to do on that aspect? Bring us up to speed. We do hear where he works, where he does business. Lafarge Cement was closed down. Is it now open? And how are you able to hold the people you have contacted in that contact tracing you're doing so far? Where are you keeping them? Is it self-isolation or the state is responsible?
The facility of the industry that you mentioned is actually a very vast facility. And that's one of the things that has actually worked well in our favor, because the index case in question transacted his business within the precinct of that industry. So it was so easy to track the contacts that he had. And the management of that company have been cooperating very well with us. They have so many facilities within, which has helped to do the quarantine, the isolation that we wanted. So within their precinct, all the contacts are there. I think they clocked us the first 7 days yesterday. There has been nobody developing any symptoms. They should be done with this process of incubation by Thursday next week. And if no symptoms is reflecting, that means they're good to go. So the management of that company has actually helped us. The facilities they have in place has also helped us. And I need also to add that as a state, we are asking the federal government, because ahead of this discovery, we prepared ahead an isolation center in the Olabisi Onabanjo University Teaching Hospital. We're asking that the federal government help us to upgrade that center to a diagnostic center so that we don't have to come to Lagos, because the situation on the Lagos-Ibadan Expressway today is really hectic, so that you don't have to go through all the hectic traffic before you can diagnose. And that way will add a bit of speed to the process of ensuring that anybody that is suspected can immediately be attended to.
We know the proximities of Ogun State, and the fact that there's some areas that are very, very far away from the capital in Abiondun and places like Shagamu. So what are modalities being put in place? So take, for instance, if somebody in Ipokia presents this symptoms of coronavirus, how do we ensure that there's enough message disseminated that can bring him in down to Abiondun and in turn send him to Lagos? We don't know how far Ipokia is, or if somebody in J4, for instance, contacts this, how do we bring them back? Do we have adequate information around all the hospitals?
As a state, all our primary healthcare center have been upgraded to Emergency Operations Center for coronavirus in this instance. And one of the things we have done is to develop an app that will make it easy for health officials to immediately carry out the tests that will suggest whether somebody's record is beginning to tilt towards the symptoms of coronavirus. And steps will be taken to move the person either to the isolation center in Shagamu or to Lagos. So all our primary health care centers, 512 of them in the whole state, including the 20 local governments, including the Ipokia that you mentioned, which is a border town. Yeah, because we having borders with Benin Republic also puts us on the firing line as well, because people coming into the country, it is goods that cannot come in now, but there is movement of human beings across the border. So all of these we have put in place just so that we're not caught napping.
Well, we've heard that the government, the state government is doing a lot in terms of fighting fake news, and that's a very good thing in a disease situation such as COVID-19, where a lot of people are not sure what exactly this is. However, there's a report I want to bring to your attention. I would like for you to clarify. The report is that the Ogun State government has deployed security officials to man the gates or houses or areas accommodating large numbers of Chinese nationals as a measure to prevent the spread of COVID-19 in the state. In fact, a particular area, the Guangdong Free Trade Zone in Igbesa area of the state precisely, has been mentioned. How true is this? And is this not counterproductive? If you are manning the premises or houses or areas where Chinese are living, wouldn't that be tantamount to first and foremost racism, for instance? Because, again, we have seen it's just not the Chinese. The index case in Nigeria is Italian.
Now, the epicenter of coronavirus worldwide is China. Italy and other parts of Europe and Asia are just like the aftershocks of the outbreak of coronavirus. Ogun State is the largest industrial hub in the whole of Africa, I mean Nigeria. And that puts us on the line because a good number of these companies in Ogun State are manned or owned by Chinese.
So it is true that you are preventing them
I'm building a case so that you have an idea of what we're doing. Now, a very large Chinese community exists in Ogun State. And in the last 2 months, we have noticed that there has been movement out and into Nigeria by some of the personnel in these companies. Now, one of the proactive measures we're taking as a state is to ensure that those instances where there have been movement in and out of Nigeria by some of them, we identify such places, whether they're industrial estates or residential estates or business premises, and seek the cooperation of the management to ensure that everybody self-isolates through this period of incubation so that we'll be sure that they are free. In the course of doing this, there was even one person who was treated or reported to have been treated for malaria recently. And we wanted to be sure that it was just malaria. So the doctor who did the treatment had to be called in, and a lot of things were asked. We even had to move this man to the IDH in Yaba. And the result came out on Sunday that he was negative. We're only being proactive. What we are doing in some of those places is to ensure that with the cooperation of the management of those companies, we restrict movement as much as possible while this incubation period lasts. And we have, of course, put them on the same page with us. It has nothing to do with any aspect of racism you might be raising, but everybody is just trying to be safe. Coronavirus is not a death sentence. It is a wake-up call, and we are waking up.
Okay. Sorry, I do have a follow-up. So are you, just to clarify this, are you doing this for only the Chinese nationals, or you're doing it for all foreigners for where you have this prevalence?
Any location where we have reasons to believe that there has been contact with either the index case or movement towards centers that we consider the affected areas outside Nigeria, we move in and be sure that those who have had contact are self-isolated. And at the end of the day, we ensure that they are free to live amongst us.
Okay, real quickly, I wanted to talk about one thing you mentioned. You talked about the app. We want to know how that app functions. Secondly, I'm excited you made mention of, the border towns, because borders like Ipokia and some other parts is just a direct pour in. And we have, this interface. How are we manning the borders? Are you using the customs? Do we have tests on people? Do we have, contact tracing and the likes? And I also want to talk about the synergy between Ogun State and our learning institutions for research and things that regard coronavirus. You made mention of Abiondun University, which is a teaching hospital of the Abiondun University. Abiondun University. So how are we collaborating? How are we making the medical, department of Abiondun be in charge of this, make more research and the likes? So three questions.
So many questions lumped into one. But let me answer them one by one. The app. Yeah. I may not be able to go into details, but it's actually an app that will help fast-track whatever immediate test that health officials carry out. You're getting somebody's temperature, you're getting any other thing that will give you an idea of whether the person is having symptoms that need to trigger the red alert. When you impute the figure that you get from all the tests that you do, the app will bring out a uniform result, such that if the man in Ipokia uses it, it's the same result that the man in J4 will get if the...
Or Leguru, where you're from.
Yes. So that's the way the app works, but it's actually for the health officials. It's not for everybody's use. They know how they use it. I don't know the details, but it's actually to help them ensure that they're able to immediately fast-track, ensuring that this person has susceptibility to this virus or what have you. That's about the app. As for the border, there is a particular kind of camera that the Federal Ministry of Health has deployed at all our border posts, which is a very good one. It scans you and immediately tells if you have high temperature. They isolate you from the crowd and they do further tests at the border post. Well, we have the problem of illegal borders. But one of the advantages that has helped us as a country is that most of the West African neighbors we have not reported any case of the incidence.
Senegal has.
I said our neighbors.
Okay, our neighbors.
Senegal is quite far off. Yeah. So most of our neighbors haven't reported any case. But then the health officials at the border post are doing what they're supposed to do. For the Olabisi Onabanjo University Teaching Hospital facility, one of the things we want, which we have requested from the Federal Ministry of Health, is to let us have some bit of exchange from the infectious disease hospital in Yaba. Let some of those staff come to our isolation center and train our people so that we can also carry out diagnosis at that location. That way, whoever is trained will also be able to impart the knowledge onto others. It's a teaching hospital, just like you rightly mentioned. And whatever knowledge that is shared there is available for others too to take from. And we believe the federal government will do the needful through the Ministry of Health and help us to get this done.
Okay, Mr. Hazzan, stay with us. We'll go on a quick break and we'll be back to talk some more about coronavirus preparedness of the Ogun State government in particular and other matters arising in the state. Stay with us. We'll be right back. Welcome back to the Morning Show here on Arise News. We still have Mr. Remmy Hazzan, who is the Senior Special Advisor to the Ogun State government. Governor Dapo Abiondun, I hope I got that designation right this time around, on communication. Thank you so much for staying with us. Talking about the state preparedness for coronavirus, we do all recall that the index case had, to make contact in Ogun State first before coming to Lagos. But let me talk about our preparedness as a country. Just this morning, we do have reports that Angola is preventing Nigerians from coming into the country, even though Nigeria has an index case of an Italian man. Some people have advocated that it's about time we stop travelers coming in from these countries that have recorded high prevalence of COVID-19. What's your take as a government? Do you think we're at that level now? Should we stop travelers from these countries, China, Italy?
Yeah, from those countries that are the epicenter, I think if we stop, we may not be wrong in the circumstance. But if we are convinced that we have enough preparedness to be able to guarantee that no infected person makes it in, we may not stop believing that we'll deploy those facilities to ensure that only those with clean bill of health are able to make it. So it's just going to be a function of how prepared we are concerning that. But as a state, our own preparedness is quite vast. We have gone beyond the index case and the facility where he had contact. We have moved into the markets. We have moved into schools. Even just yesterday, or the day before yesterday, that was on Wednesday, our health officials in the state moved to the redemption camp, areas where you have high incidences of crowd, just so that you sensitize them. And whoever is the leader of the health officials there also puts them on notice. Now, if you see anybody looking like he or she is susceptible to these symptoms, please raise alarm so that we don't give room for chances. So we have gone beyond the index case in particular. Our advocacy has gone all round, and we're not stopping until this endemic situation subsides completely.
Okay, I just really want to veer, of course. I want to talk about infrastructure and the likes and politics in Ogun State. I'll link the first question from infrastructure into coronavirus. I mean, how ready are we, even in Olafisi Onabanjo University Teaching Hospital in Shagamu? Because I've been there a couple of times, and I have qualms with infrastructure. The buildings are still the buildings that were built in the 70s. There are some wards that are decrepit already. That place needs a total infrastructure revamp. What is going on around there? And I also want to second that with that draconian road, the Shagamu-Ikorodu road. It has been there since, goodness me, since I can remember 1997. That road has been like that. Links a major cement factory to the heartland of Lagos in Ikorodu. What's the government doing? There's a lot of politicization on that road. What's the government doing as regards that road? Let's talk about infrastructure first.
Again, you have lumped two questions together.
Yeah.
Wanting me to come from the health sector and move to the road infrastructure sector. But I'll do my best in the circumstance. For the Olabisi Onabanjo University, I don't know the last time you were there, but since this administration came in, we are attacking the challenge of that tertiary health institution on two fronts. First, we're attacking it from the front of the personnel, which are grossly inadequate. And one of the things that the state has done is to ensure that medical doctors, pharmacists, and other medical practitioners needed to ensure that the place keeps going are employed. That has been done. Even the physical infrastructure is part of the 2020 infrastructure plan. And I'm sure by the end of the year, whatever it was that you saw before now, it's not going to be the same thing that you will see. Of course, it's going to be a continuous thing. So we take it one after the other. It's part of the core of our health care delivery plan. If that place does not achieve what it is set to achieve, then the totality of our healthcare system might even fail, as it were. Now, move to the road infrastructure that you asked. Part of our plan as a state, which is very deliberate and intentional, is that we are moving away from the no-money syndrome that pervades road infrastructure. Road infrastructure happens to be a challenged sector because it is one sector that has the least private sector participation, simply because the return on investment is not as fantastic as other sectors. People go into private health investment. That's why you may choose not to go to a government hospital and go to a private hospital. You can generate your own electricity within your house, power your generator. You can decide to generate your own water. But it's a difficult task to build your own road. Very, very difficult. So what we have done as a state is to bring up a PPP law, a public-private partnership law, that will encourage private sector participation in road infrastructure. And that law also established the PPP office in the state. It lays bare what comfort and protection any intending private sector person will have if it decides to partner with us. And we're choosing some roads that such PPP arrangement can be used to build. The Ekpe-Ijebu-Ode road is there. The Ikorodu,
that's going to be a 10-lane highway.
Yes, 5 lanes on each side. Now, the idea is, if you build such road under PPP arrangement, it can be tolled. Because tolling it is the only avenue for getting back the investment of whoever the private sector participant may be. Now, the challenge we have on the Shagamu-Ikorodu road is that it is a federal road. Now, it makes the entire arrangment tripartite. Whoever we have as a PPP person, us as a state, then the federal government. So we are saying, federal government, help us. Our people don't care where we get money, how we manage to do it. They just want to see road. Please hand this road over to us. It costs you nothing. Once that is done, then the PPP person moves in, we sign the agreement, and the road will be built. And we're hopeful, because the last discussion the governor had with Mr. President on this was a very fruitful one. Any moment from now, we may get the go-ahead to take over that road. Abeokuta, Songo, Lagos Road is also another one we're intending to handle under that PPP arrangement. So we are doing everything possible to ensure that we change the infrastructure template of Ogun State, especially in road construction.
Well, that's good to hear. Let's talk about security now. What was originally termed the regional security, well, now we do know that every state needs its own law, which has now been passed, the exemption of Ekiti State, which is now a law. Bring us up to speed on where Ogun State stands since the House of Assembly passed that law, that bill, and the response of the people, and, you know, the whole architecture of Amotekun and how it functions in Ogun State.
All right. The Western Nigeria Security Network, which has dovetailed to become the Ogun State Amotekun Corps, the law was passed by the House of Assembly this week.
Yes.
I expect that any moment from now, the Speaker and some of his principal officers will present that bill to His Excellency the Governor for his accent. And once that is done, we hit the ground running. The structure of the Amotekun Corps is such that is the same across all the southwestern states, so that there can be a handshake across the border, because the collaboration really is what will make it as effective as we want. And majorly, they are going to ensure that intelligence from the community that the police does not even have access to can be converted, or information rather, can be converted to actionable intelligence, which will now help to nip crime in the bud. The police does not even have enough manpower to police the open area, not to talk of the forest. But those who understand the terrain can do so effectively. Those are the areas that we believe the Amotekun Corps will help to make the police do what they are supposed to do. They're to work together, ultimately. And we believe that that working relationship is what we actually...
But what is recruitment like? What is payment structure like? Would that also be a regional thing or state by state?
It's going to be state
the recruitment
by
process
state,
for Ogun
but
State?
I'm not going to be surprised if at the end of the day it's the same across board. But every advisor to each of the governors on security are still going to meet and work out some operational modules that will make them take off at the same time.
When are we likely to see this operational? Do you know? When do we envisage Amotekun to go into effect?
As now. If I hear that it's going to start next week, I'll be the happiest person. But I expect that it will be sooner than you expect.
I've got 2 quick questions on infrastructure. Number 1, the Ogiri trailer park.
Here we have to go.
Sorry.
We're out of time.
It's time for it. Okay, we still have 2 minutes out here. Okay. So real quickly, the Ogiri trailer park. Constant accidents in and around there. I mean, what is the state government doing about that?
It's not the trailer park causing accidents.
I mean, the way the trailers park.
Okay.
Yeah, okay. The way the trailers park. Constantly constant accidents around there. What's the government doing around that? And also, the leading up to 2023, I mean, we start talking politics now. The Yewa question. Who's going to build the cat on that? Just 2 quick questions in 2 minutes as we wrap up.
All right. For the trailer park thing, there is a master plan for a major trailer park along the Lagos-Ibadan Expressway corridor that will take and soak up almost every available articulated vehicle along that route. The state government will still use the same PPP arrangement to get it built. And that arrangement will come on stream anytime soon. And because it's going to be PPP, it's just for us to provide.
Where's it going to be built, Ogere?
Somewhere along the corridor close to Lagos, so that it can serve both Ogun and Lagos State. Because the bulk of these vehicles are heading to Lagos, either to lift fuel or pick goods from the port. So once there's this working relationship between the two states, vehicles that have no business for that day remains at the park until they're needed. And that is the idea that will help us nip this idea of a trailers parking on the road there. For the Yewa question, it will be too early to start talking about regional politics. But one thing I am sure of is that Yewa's time will come, and it will come in our lifetime.
Okay, thanks. It's a great place to end it. Like Civic, thank you to you, Remmy Hazzan.